There's a newer form of acupuncture that was developed in the 70s in China by Dr. Zhao, and it's been developed by a number of other practitioners and physicians since then. I've learned the technique from Jason Howe, who is a well-regarded practitioner in New Mexico. It's a form of Chinese scalp acupuncture. And what the Chinese scalp acupuncture is different than traditional body acupuncture. We needle a little bit differently, we manipulate the needles a little differently, and it relates to the locations in the brain where certain motor, which is movement, and sensory, which is pain, problems reside. So it can be extremely effective, not just for sensory problems like pain, or neuropathies like burning neuropathies and things like that. It can also be really effective for motor problems, and motor problems are movement problems you can see with anything from MS to spinal cord injury to traumatic brain injury to even possibly ALS. Although I don't have direct experience with ALS, in theory these things would be working a little bit with some of these motor problems as well. Dr. Howe has a large series of experience with this. My experience isn't as large as Dr. Zhao's, but I've seen at least 5 MS patients who come in, let's say, with a little bit of a limp, and they will leave with much less of a limp. Or they'll come in with a headache, or they'll come in with trouble with the vision, and there's a visual sensory cortex in the back, and you can actually improve the vision. Now, these improvements in chronic neurologic problems like MS, these things that are not going away, are temporary, and they would need to be repeated. But you can improve the quality of life, and especially for things like vision and reading, for a number of weeks. And I don't know what that number would be. It's different for every person. I would hope it would be in the 4 to 12 week time. For people who have things that normally get better, like post-stroke. After a stroke, you expect a stroke to improve unless there's been serious damage. It can very much accelerate some of these problems, like the hemiparesis, or trouble with speaking, which is the dysarthria. And there's a link to a YouTube video on the website that shows Dr. Zhao in California using this on a stroke patient. And it's a very robust and very, very useful technique.